the World Healing Tour movement with your host, Noah Crane. Heal yourself, heal the world.
Hey everybody, my name is Lisa Ray. I'm a literary agent and I'm working with the media team here at The Grass Grows where I am, and we are so excited to bring you a co-author experience where you will grow your brand and your visibility. Click the link below and apply now for free, and we will see you inside the pages of The Grass Grows where I am.
Hello, and welcome to the World Healing Tour podcast, where our mission is to help you heal yourself so you can heal the world. Hi, my name is Noah Crane. Each week, we will bring you tips and tools and inspire you to live your most empowered and joyful life. I'm also the author of the book, The Grass is Greenest Where I Am, because the grass is greenest where you are when you say so. When you choose to live in your own love and light and share your unique gifts with the world, with no comparison, no competition, and no scarcity. And that's why it's called World Healing Tour, because when you heal yourself, you truly create that path and that ripple effect for others to heal as well. Each week, I bring incredible guests into studio to help pour into you and help you on this journey. I'm super excited about my guests today. Dr. Sam and Dr. Dan are a dynamic force in the chiropractic care. They are dedicated to transforming the health and wellness landscape through innovative techniques and personalized treatments. At Atlas Clinic, Dr. Sam and Dr. Dan have unwavering commitment to advancing chiropractic care for their patients. Their dedication to the community and the ongoing education of patients highlights their role as pioneers in the health and innovation, setting new standards for chiropractic care in the industry. Dr. Sam Carney and Dr. Dan Hulsey, welcome to the World Healing Tour podcast.
Thank you
for having us.
Yeah, I'm so excited you guys are here, not only because you guys are both such incredible chiropractors, but also the fact that, you know, I am your patient as well. So not only do I get to represent you and show the people what amazing chiropractic care is, but I also have experienced it myself. So
Absolutely.
Thank you for taking such good care of me. I'm
No
truly
problem. Thanks
grateful.
for having us.
Of course. So I also wanted to mention that I'm just really grateful to be a part of your journey. You've been a speaker at World Healing Tour, and you guys are both making such a huge impact in the world. And I know you're so committed. Why holistic health? Why are you both so gung-ho about using holistic health to help people heal? And I'll start with you, Dr. Sam.
Yeah, I say the medical field kind of failed me, I guess. When I was in a car accident, I was told to go home and rest, and it wasn't until I found chiropractic care that I really started getting better. So,
How old were you when you had the accident?
16 years old. I was a young one, 12 days after I got my license, fresh. And
Wow. So tell us about the accident.
yeah, so I was essentially just turning left, and it was a yellow light, and the car sped through the yellow light, crashed into me, and airbags deployed. I had a bloody nose on the scene. Paramedics checked me out. You're good. You can go home. So I went home. I went to my medical doctor the next day. He said, yeah, she has a concussion. Don't play soccer for a week. Rest. Do what you can. So I listened. I rested. But I had headaches that had intensified. They were there every day. Migraines, they turned into sometimes. I started becoming really anxious and depressed. I started failing classes in school. There was an entire personality shift in me. I started breaking the rules. I started becoming a rule breaker, testing my limits. And I was just in pain, unhappy, and hurt. Yeah. So it wasn't really until chiropractic care where I started getting out of pain, making better decisions, and look where I am now.
It's amazing. And I read in the chapter, because you're part of the anthology, The Grass Grows Where I Am, which I'm really excited to showcase your work, that you had a lot of headaches.
Yeah.
Let's talk about the headaches that you had.
Yeah, so I remember having headaches ever since I was a little girl, coming home from daycare, sitting in the back of the car with a headache. I always thought, because I had poor eyesight, that they were related to my eyes. Never really thought much of it. Took Advil, did the job. But after my car accident, they were too much to manage almost, where I was taking Advil almost every day. And I just thought, what kind of life is this for a little 18-year-old girl? I don't want to grow up on medication my whole life. So it was after I really graduated college that my mom said, go see my chiropractor, see if she can help you. And after that journey with her, my mind was set, and chiropractic care was a lifestyle for me. So
It's amazing how, you tried something different, something holistic, and you were able to find, more, comfort and peace and feel better just by doing that instead of putting all those meds down. That's great.
Well, and it kind of changed my mindset to where it's like I thought my body was wrong. I have poor eyesight, so that's why I have headaches. It had absolutely nothing to do with my eyesight. I had a trauma. My bones were misaligned, therefore lack of blood flow to and from the brain. And once you fix that and you give it a solid fix, wow, your body can really heal itself naturally, all on its own. And you don't need the medications and the surgeries and all that kind of stuff. So
I love that. And I want to get right back to you again because I have more questions, but I want to get over to Dr. Dan over here. Dr. Dan, your story is incredible too. And I know you love holistic health. Why are you so passionate about holistic health?
Yeah, I mean, very similar story to Dr. Sam. The traditional medical route failed me. And I spent 6 years in the Army in a recon sniper platoon. And when I was in Afghanistan, it was hard on the body. There were traumas, there were falls, there were cots. We slept in holes for days. I came back and same kind of presentation. I had a bad low back pain. I had a herniation from one of the accidents that happened over there. Compression injuries fell on my neck. And same thing, I was getting headaches every day. Around 4 to 5 p.m. I always would get a headache. And some days they would put me in the bed where I was just lights off, cold compress on my head, and just try, like I had a playbook, when I knew that headache was coming, I did my couple little things, shoot a little coffee, take a little bit of my Tylenol, Advil, do the dark cold room, and that just became excessive. And so I went through the VA process. I was on the 6-7 different medications for the headaches, the nerve pain, the anxiety, the depression, the sleep, the ADHD, all these things that they had diagnosed and put labels to. And through that journey, I just wasn't getting any better. I was a zombie. I was 24 years old at the time, and I was just like a shell of a human. And I had a bad injury one day in the gym, just lifting weights, and I had herniated a disc in my neck because of that instability. And so I got the disc from the VA. I went home that day because they took the image and they said, all right, yeah, we'll give you a call here in the next week or two and let you know what's going on. And so luckily I had the foresight to take the disc. We stopped at just a chiropractor on the drive home closest to my house. I didn't do any searching. I went in and I just said, hey, here's a disc. Can you look at this? Something is wrong in my neck. I can't move it. And so he looked at it and he did some line drawing and he said, oh yeah, just a herniation here at C5, C6. You want me to fix it? I was like, what? Just right now? And he's like, yeah. And so set me up, did a manual adjustment. It hurt like a you-know-what. But within that next 4 days, I was probably 90% better. On the 5th day, I'm 95% better, right? And I get the letter in the mail from the VA, and they say, you have a C5, C6 disc herniation. We'll give you a call and have you come back in for a follow-up in 4 to 6 weeks. And I'm just like, oh my goodness. All these other veterans are waiting from 4 to 8 weeks at a time to try to get care for something that can be solved like that. And it all just kind of hit me at that moment. I had structural problems that the traditional medical route was trying to band-aid with chemical solutions. And that logic just doesn't make sense. I had structural problems. I needed a structural solution. I made more progress with that chiropractor in 3 months than I made the entire 7-year span that I was going through the VA's process. And it was that point that I realized, man, the body does have the ability to heal. And we learned that in school, that the power that made the body heals the body. But that became true to me, and I saw my body making the gains. I was slowly getting off the medications. I was functioning again. My personality and mood was coming back. I was out of that pain, depression cycle, and I had the ability to heal. And it was at that moment that it was like, man, there's no better gift than to give someone back their life and their health. I want to do that.
I love that. Health is wealth, right?
Health is wealth, and you don't realize until you don't have your health.
Yeah, it's everything. And you're also a professional player, right? What did you play? Golf?
I wouldn't go that far.
No?
I like to play.
Uh-huh.
I'm decent. I dabbled
Well,
with
I've
that
seen
when I
some
was
pictures
going
of
through
you,
school.
yeah.
But no, those guys are sickos. I'd shoot maybe par 1 under on a round, and they'd shoot 8, 9 under on the same course. It's a very big gap, but
But
yes, I
you've
like to
always
play.
been very athletic
100% no.
and
I played baseball, I
competitive
played
and
football,
yeah.
played golf all through high school and growing up. And honestly, it's what's crazy now as we look back at all the traumas I had as a child, and each small trauma adds another new compensation or a new pattern that when left untreated or not even looked at for 20, 30 years, you develop these imbalances, and it makes sense why so many people are walking around. I don't want to say a ticking time bomb, but there's just you only can compensate for so long until the body's degenerated to a point where you start to really feel the symptoms. And I think one of the best things I've heard is, listen to your body when it whispers, so you don't have to listen when it's screaming.
Oh, I love that. So do people wait too long to go get care? Like, is it something like you said, like I felt I got injured, my disc got injured, I stopped at a chiropractor, I got adjusted, and I started getting better. Are we waiting like way too long to go get treated? Is that what you see with patients?
I was already vulnerable from the sporting traumas I had, from when I fell down the stairs at 3 years old. Now, when you're young, you have the ability to heal a lot easier. And so, the parents ask the kid, how you feeling? Oh, I'm okay. They're rubber, they'll heal. But over time, they cause these imbalances. And I think too many people are being reactive versus proactive, and they're waiting until there's a problem. And by that point, it's too late. The weightlifting injury was just the last straw. I was vulnerable before I walked into that gym that day because of the imbalances that were present in my body. And so if someone would have educated me during my transition point in the Army, or if that was a standard in our home, it might have been a different conversation. But you don't know what you don't know. So people aren't wrong for it. They don't know, and there's a lot of misinformation. And it's tough in the chiropractic profession because there's not really a brand standard.
And don't we always kind of put ourselves last? You know what I mean?
Of course.
Like we always,
well, and especially men.
Yeah, men and just things get in the way, it's like, it's your own integrity with yourself. It's your own it's like self-care, right?
Yep. No, and I hear patients that say, oh, well, I have a high pain tolerance. I can handle the pain. That pain is your body slowly degenerating. So I'm happy for you that you can withstand the pain. It's silly. Mm-hmm. Why would you let your body to continue to degenerate to a point that 20 years later, the only solution is surgery? Because you could handle the pain for 20 years? Good job, bro. I mean, that's not ideal.
You don't get a medal for that, right?
No. And it takes away from your quality of life. It takes away from your kids. It takes away from your wife. It takes away from your work. Your health is your investment. Your health is wealth. You said
Absolutely.
it perfectly.
And just talking about the posture, right? We're a very stagnant society these days, right? Yeah. We're sitting a lot behind computers. Kids are on their phones all the time with their neck down. I keep telling my son, lift your head up all the time, right? Don't look down, It's so easy to throw our body off, and to get injured in general because, the neck is vulnerable. It's not, right? Let's talk about that.
It's protecting your brainstem.
Yeah.
Yeah. Well, and especially the very top bone too. It's not being held in there by any other bones. It's being held in by ligaments and muscles that also can have trauma with little car accidents and little fender benders that you don't think are a problem. But they can absolutely misalign that top vertebrae and cause neurological imbalances throughout the body.
Yeah, so let's talk about, I want to get back to the Atlas and talk about the Atlas, but I want to talk about your story of how you met.
Yeah.
Because I think it's so sweet how you guys came together.
It's a cool story.
Yeah, and how you actually brought her to your chiropractor to help her heal.
Yeah.
And I also read that you used to be overweight until you started getting adjusted, which was really interesting to me because I didn't even know that's tied to that. So let's talk
Hormone
about
balance and metabolism.
Let's talk
absolutely.
about first how you guys met because I think, and then we'll talk about all that.
Yeah. So we both signed up for Palmer College of Chiropractic. The way the school works is
where is that? Where is that school?
Port Orange, Florida, right by Daytona Beach. So we moved down there. The way it works is you have a class, and that class takes all of the same classes for the entire 3.5 years that you're there together. So we were in the same class. There was 40 of us, and we became really quick friends. when I started going to chiropractic school, I started getting adjusted by the students who were learning how to do the adjustments. And so very quickly, my headaches unfortunately came back while I was in school. And because Dan was my friend, he got to hear how much pain I was in all of the time. And he said, look, Sam, I know a guy. He does something completely different. You have to trust me when I tell you it changed my life. I need you to go see him.
How did you find him?
My dad, he saved my life. My dad met him at a supplement convention, and he was with the chiropractor who was speaking on stage. And my dad knew that I was looking into going to chiropractic school because of the success that I had with traditional chiropractic. My dad talked to him. He said, if your son's really serious about being part of an industry disruptor, technology that's going to change chiropractic for the next foreseeable future, he needs to be at this seminar next weekend. And so I was in the Virgin Islands at the time on a little trip. My dad called me. He said, dude, there is a seminar. I just met this doctor. He has advanced technology. His adjustments hold anywhere from 2 to 3 years, not the 3 times a week over and over again, the traditional chiro you're used to. And so I was intrigued, and I booked a flight. We went back home. I drove across the state. I went to the seminar, and I heard countless doctors that had been in the profession for 30 to 50 years saying that they've tried all these different types of chiropractic. They've practiced all these different types of ways. This is where they've landed after their 50 years of investment into the profession. And out of all the technologies they've seen, this is the one that creates the biggest bang for the buck and can do it in the safest, most effective manner. And I came from a reconnaissance sniper platoon, so my mind was wired to think about compensations, to think about the customized calculations for each individual shot. It's no different with what we're doing here. Every patient is their own patient. Every patient has different asymmetries. Every patient has different lifestyle factors. And so every new patient is a new calculation. So I liked their specificity. I liked how safe it was, and it gave you the ability to work on all types of populations. But my dad introduced me to him.
That's amazing.
He took my dad's migraines away with one adjustment. He took care of my mom's sciatica away. Their adjustments held for 2 years. I thought it was BS, honestly. When he first sent me over there, I thought, no way, like this like my dad's being dramatic. This guy must have some snake oil foo-foo. I don't know what's going on, but I was desperate. And like Sam said, the traditional route had just like failed me, and I wasn't making much progress. I had made so much progress with chiropractic, just generally. I'm thinking, well, man, if there's someone who is the same level of specificity like how we were in the military in that branch, and now that's that branch of chiropractic where it's 1% of the 1%, I'm intrigued. I'll investigate it. And so I went, and
Plus, you have such great parents. How can you not trust them?
They've never
right?
steered
I
me
mean,
wrong.
they've never let you down.
They
Come
are
on.
phenomenal.
And what's really cool is that that his parents actually run the clinic. I mean, they're the front desk people. They're people that greet you when
Family
you come
operation.
there. It's family operated, so you always feel like it's just such a great feeling. And I mean, they're just so efficient and such good, solid people, you know?
For sure. I mean,
So
she ran
you
government
definitely-
agencies for
Yeah,
30
she's
years.
amazing. She's a boss.
She's
a
the rock.
boss.
My dad's the wind. He's the dreamer.
It's
But
so
like, we need
beautiful.
it all.
Yeah, it's perfect. It's it's such a great balance, you know?
No, and it is too. And I think the patients feel that. They come in there, and I think a lot of them assume, is Sam also your daughter? And it's like, we're just one big family there.
Yeah.
And it's that's a cool vibe for sure. And now even
Definitely.
same thing with Dr. Ryder. It's been cool to see the dynamic there in the clinic.
I love that. I love the family feeling. That's really special. All right, so let's go back. You take Dr. Sam
Yes. So
to heal from this technology that has helped you.
yeah, I mean, we booked her the appointment, and I already had seen 6 or 7 individuals with 6 different disorders or diagnoses. One was Meniere's disease, one was vertigo, one was migraines, one was sciatica. All these different individuals that flew in from all over the country. They all got the same advanced procedure focusing on the atlas bone, and all of them drastic improvements within 3 to 6 weeks from one treatment. They didn't stay there. And so I'm like, I was pretty confident, and especially because she had the headaches, and at that point I think we were...
So where was the clinic from where your school
We
was?
were in, the clinic was in Clearwater. Our school was in Daytona, so straight across Florida, straight west.
3 hours.
3
3-hour drive. So you took your co-student, whatever it is.
Took my new friend
you knew
across
best
the state
friend
on a road
across the
trip.
state. Yeah,
You got it.
I love that.
And she
so
got the
much.
treatment.
That is
and
so special.
Then what happened that night?
That is real friendship.
Yeah, it quite literally changed my life. It wasn't an adjustment that took away the pain. It was an adjustment that healed my brain, literally.
Wow.
I woke up the next morning, no brain fog, didn't even know I had brain fog, and woke up with a clear head and was like, whoa, this is how people wake up at 7 a.m., bright-eyed and bushy-tailed, and it was just a new beginning for me. I was finally motivated again. School became so much easier for me. I just felt like my brain was working and I could think again, and it was completely different than just the traditional adjustment that I was getting. So after I felt the results from one adjustment, to me, it was a no-brainer. I have to practice this way. I can't do the traditional racking and cracking. It didn't give me this result. So
Wow, that is so cool. So your dad healed you, you healed Dr. Sam.
Healed the
it's
world. It's a ripple
Yeah,
effect.
it's that
It
ripple
really
effect,
is.
right?
Got it.
I
you're
love
onto
that.
something with that.
Yeah, that's amazing. And you lost weight through that.
Yeah. So I think that came back to my motivation. No, the sound wave didn't suck 60 pounds of fat from my body, but I was not
Catalyst.
in pain, and I could go and work out, and I could make proper decisions on what to eat and when to eat it. And it completely transformed my lifestyle. I wanted to be the healthiest I could be and really protect my body, because it really is such an amazing healing thing that we have. So over the past 6 years, I've lost 60 pounds, and I honestly
Wow,
have
I would never think that.
I've never felt
I look
better
at
in
you
my
and you
life.
just look like you're just in great shape. Like
Yeah.
you would never think. You just
Yep.
look like a naturally thin. And you were 60 pounds more than you are now.
I was 180 pounds. Yes.
Wow.
Yep.
Did you meet her like that?
Oh, yeah.
I can't.
We look back at photos and it's like,
Seriously,
whoa.
I
Who
wanna
was
see,
that?
I want to see that photo because
I'll
my
show you.
God, you literally are a picture of health. Okay, let's talk about the atlas bone
Cool.
and why it's so important to have it aligned properly and the technique you guys use to help people heal. I love the story. And one more thing. So after that thing, you guys continued school together and you decided you're going to open a place together when you're done with school. Is that
got
how
it.
it kind of went?
Absolutely.
Yeah, we had such great success in clinic as students utilizing this technology, so much so to where the president of the school is sending their family members in. When other doctors and other clinicians who have been practicing for 10, 15 years bring their families in to have the new students treating them with this advanced technology, because they had never seen healing happen that quick for what we were achieving as students. And so when we saw that, we're like, I think we're onto something here. This isn't just like placebo for us, like this is duplicatable. And we'll talk a little more about the technology here in a minute, but yeah, that is
It really did just give us the confidence to go out and do it. There was no way in my mind that when I signed up for chiropractic school, I thought I was going to be a business owner ever in my life. But seeing the results, it really was just kind of like,
no other choice.
let's go do it. We gotta.
So you guys worked for a while. Tell me about Epic Clinic.
Yeah, so probably 6 or 7 months we worked at the headquarters of where the technique
In
was
Clearwater?
created in Clearwater, where we
Nice.
both received our first adjustment.
Yes.
That doctor, Dr. Stan Pierce Jr., he trained us, certified us in the Epic technique, utilizing that piece of equipment.
He created the
Yeah,
technique.
created the technique, he created the table. He's the brainchild behind it all, and we were fortunate enough to be treated by it and then learn it. His late wife had medical complications, and so very early, right after graduating, we were thrown into his clinic as just, hey, I have to leave with her. I need you guys to figure it out and run it. And so we did. And once we knew that we could not only have success in clinic, but then maintain an already successful business and model, it was another no-brainer that we need to do this for ourselves. And one thing led to another, and here we are 3 years later looking to expand. We've just hired a new doctor. We treated patients from over 6 continents. It's cool.
Yeah.
It's so cool. You guys just jumped in head first.
We
You
had to.
trusted the process. You guys knew that you'd be good
We
together.
trusted the results, and you know
Yeah.
what? Every single human out there has an atlas bone. Every single person is a potential client or potential person we can help save.
Yeah.
So
And what was
we're
really
not
cool
limited.
about working over at the Epic clinics was we were fresh out of graduation, but
Brand new.
we were seeing patients that had been treated by that doctor for the last 10 years, and it was a seamless transition. So it was amazing, honestly.
It's so cool how he gave you that leader role. you know, and you literally, like, it opened and you guys just walked right through it. You know, you had to trust yourselves and know that you're good and you're going to, you know.
Well, and
it
for
just-
us, what we always had to fall back on, and I think it was a big piece of why he believed and had the confidence in us, he had confidence in the technique. He had confidence in the way that we approach it. It's the same reason why they have the published studies with Harvard Medical and the orthopedic journals. The technique has been evidence-based in research. And so when we alluded earlier that our profession doesn't have a brand standard, if you go to some chiropractors, they twist, some crack, some want to strengthen you, some want to stretch you, some want to use e-stim, some want to put crystals on you. There's all these different things. It's tough to find something you can trust. When you have something that is evidence-based by research and it's duplicatable by utilizing technology, that's a different conversation. And he knew that the two students he had trained were very proficient in the technique utilizing the technology. You don't have to wait 20 years to become a good chiropractor through experience. You just master a technique that is already evidence-based and proven, developed by the last 100 years of all chiropractic knowledge.
I
It's
love that. How
different
much
conversation.
confidence did that give you in your lives?
A ton.
I mean,
And then when you see the results, if you have a proven technique, you get duplicatable outcomes. I mean, you're a patient of it. You know the difference of how your body was pre being aligned and how it is now.
Absolutely.
There's two different feelings of connectiveness, balance in the spine, nervous system balance. I mean, it's multifaceted. It's not just muscles and bones.
Yeah, talk a little bit about the atlas and why it's important to align the atlas and you know, how it really works, where it sits and all that. Because
Yeah.
people that don't know.
So the atlas bone is the very top vertebrae in your spine. There are no discs above or below it. It's unique in that fashion. There are no facet joints at that holding it into the bone above or below it. It's protecting your brain stem. It's protecting all of the blood flow going to and from your brain. And it is the most vulnerable part of our entire spine. It doesn't take a huge crazy accident to misalign it. Birth is honestly, we see some patients that are misaligned at birth. So it's a very vulnerable region. And with that being said, you need to be very specific when adjusting it because again, it doesn't have discs holding it in place. It doesn't have facet joints holding it into place. So you have to use a different technique when adjusting it, which is why we use a sound wave. There's no twisting, there's no popping, there's no cracking. We can identify where that misalignment is down to the 100th of a degree and fix it within a 100th of a degree. And because we are so specific, it stays in good alignment.
How does the sound wave work?
Yeah, so the sound wave, it's kind of like, think about if you're sitting in traffic and there is somebody that pulls up next to you and their volume is up so loud that you can see your rear view mirror shaking. That is a sound wave moving that rear view mirror. So sound carries mass, and Newton's laws, when mass hits mass, mass moves. So we are just using the sound as a force to move that bone. And again, because of the vulnerability of that area, you don't need a whole lot of force. You don't need a crack in order for it to move. You need a gentle force guiding it back to where it should be.
It's amazing because you don't even feel anything.
No.
It's just like, it's a special machine that you guys use.
I mean, there's an electromagnetic striker that drops, and it's what compresses the energy and creates the sound wave. The way that they've measured that force and know how much force needed to move that bone, they measure it based on the friction that's happening between skull and atlas. And so they get that force, they put it into it. It just gives us the ability to move the bone. But she hit the nail on the head. It's not so much about the sound wave, it's the fact that that region is so vulnerable. It doesn't have the same discs that hold it in place. It doesn't have the same joints. So you have to be able to use something more specific.
Right. That is so important. All right, we're going to take a quick commercial break from our sponsor, and we'll be right back. This is a great conversation.
Cool.
Hi, I'm Chris Trammell. I'm the marketing director for The Grass Grows Where I Am, and we can't wait to work with you. And if being in this anthology book would make a difference for your brand, your visibility, and your profitability, click the link below and let's get you started. Can't wait to work with you.
And we are back with Dr. Dan and Dr. Sam from Atlas Clinic. I wanted to ask you guys, you know what I think would be really fun? To talk about some stories of people that you have healed and helped, because I think people will be really interested in, you know, how they came in and how they left. So Who wants to start to share something about a patient that came in, maybe couldn't walk or was dealing with some kind of health challenge, and how they've been able to change their life and get more healthy?
Yeah. One of my favorite ones is he's an 18-year-old kid. He's had bad migraines since he was 5 years old. When he was 5 years old, he was running. His uncle was chasing him. He tripped. He fell in the bathroom and he hit his head on the toilet. From 5 years old until he was 18, for 13 years, he dealt with debilitating migraines, 2 to 3 of them a month, like almost every single week, but with daily headaches. He had been to neurologists, he had been to the eye doctors, he had been to all these different professionals. No one ever looked at his atlas. And again, being the most movable bone and having any kind of a head trauma or neck trauma, atlas is going to be involved. We had a patient last week, she broke her hip, her atlas, whiplash when she fell and hit the hip out of alignment. And so for this kid, I was very confident because we do headaches well. If I could only pick one thing to treat in the clinic, it's headaches because it's the quickest, easiest thing to fix. And it's just literally a switch. But for him, we did the correction. He came back, I don't know, 2 or 3 days later for a follow-up. And he said, hey, it's been 2 or 3 days. My neck's really tight, but so far, no headache. And so, okay, it's just been a couple days. Let's wait and see. A couple weeks later, comes back for the follow-up. Hey, doc, still no headaches. Neck's no longer tight. I'm feeling pretty good. I said, okay, let's keep watching it. And I always tell patients, you should expect to see the symptoms decrease with frequency and severity. And we're going to watch that trend over the next 4 to 6 weeks as the body heals. Because when you fix the atlas, besides the blood flow, it's balancing all the muscles that are supporting the spine. There's a neurological tract that feeds in from the neck muscles and then sent down the rest of the body. And so when that bone's out of alignment, you're going to have one side of the back tighter than the other, one leg a little bit shorter, et cetera, et cetera. So for him, still now, it's been 6 weeks on a follow-up. His body's still balanced. He's got no more headaches. It's been 7 months now. Kid has not had a migraine since we had the correction. And now he's coming out of his shell. He's able to go out and start working out again. He's trying to become a bartender and he's just working through all these things, but he has the ability to freely do it. And, that's obviously talking about someone that has a severe case. We have a good buddy who does some filming for us that really didn't have too many issues. He had a little bit of a back injury and a strain. He used to be a wrestler. And so he one day at the gym just had bad sciatic and just his back locked up. He didn't really talk to me so much about his brain fog and everything else. We did the correction. I think a couple days later he came in, hit full functionality in the back, and he said, Doc, I am so clear and I am so sharp right now, and I can't even explain the difference that I'm feeling. That's not a severe case, but that's the normal kind of patient that life happens. Mm-hmm. In the gym, had an injury. He'd been vulnerable for the last 10 years because of the traumas as a wrestler and a football player. Living with instability, living with vulnerability and one side being imbalanced. As soon as we put that back in alignment, I just checked in with them earlier, still cruising, no issues. The body's maintaining balance and symmetry, and like what Dr. Sam alluded to, the technology being as accurate down to 100th of a degree and the x-rays being customized to each patient, it stays. When the adjustment has the ability to stay, the patient heals. You don't heal from constantly being twisted and cracked over and over again. You heal from maintaining brain-body communication, proper blood flow, proper symmetry. That's how you heal.
Yeah,
It only comes down to accuracy, though.
Yeah, no, that's great. Those are great stories. Yeah. I love that. That's awesome. And those are things that really impact your life when you have a bad headache. And I mean, that's huge. Or lower back pain, Yeah. How about you, Dr. Sam?
Yeah, so he did really good on the pain ones. I have one that's not necessarily associated with pain, but I have a young female patient who came to me. She had headaches, but she told me that she was told by multiple doctors that she was infertile. So we got her adjusted and she came back in for a follow-up within a month of care. And she said, Doc, I forgot to take my supplements before I menstruate. And I had a normal period this month. I didn't take my vitamins. What is going on? And I said, yeah, your hormones are controlled by the level of the atlas. So absolutely we see that. We see that time and time again. And she came back in recently. It's been about a year since we've treated her. And she actually told me that she is pregnant. So the infertility was not really an issue for her once her body was able to heal herself. So that was a really fun one for me.
That's a great story.
Yeah, we've heard that chiropractic can help with pregnancy and fertility, but to see it in our own office was really, really fun and really special.
That's great. And it probably like also helps because when the body's out of alignment, it's going to be more stressed, right? And so if you're taking the body out of a place of stress, then you're going to be more relaxed, and therefore everything can just flow easier in your body. All
Work
the
the way it
systems are
should.
working better, right?
Yep.
And so you'll be able to relax more, and and obviously get pregnant because you're not as tense or holding the energy.
Well, and the understanding of that being is the balance of the nervous system and its ability to adapt. And so you have two sides of that nervous system, right? Your sympathetic is your fight or flight. That's your rest, and then your parasympathetic is the rest and digest side. That vagus nerve sits right on the front of the atlas transverse process, the front side of that bone. And so if that bone is rotated, causing pressure on the nerve, your rest and digest system can't turn on. So these are the like restless leg people. Their mind is always racing. They're kind of go, 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 go. Their body never has a chance to relax and get to the healing side. And so when you have the ability to take the pressure off that, we've seen the objective studies, 200% increase in parasympathetic function from one correction. You see personality shifts happen over the span of 5 to 7 days as the hormones balance, as the brain chemistry starts to balance out, and it's full body connectiveness.
Yeah, no, that's so important, and I love the stories because people relate to it, right? Because we're all going through things, and sometimes we're pushing it aside, and and when we actually take care of ourselves and we come in to see you, as I can speak for it, it makes a huge difference because I do feel good in my body when I walk. My posture does feel better. You've shown me all kinds of exercises to do and things to strengthen myself, and it is so important. I mean, we've had people come to you from other countries,
6 different continents now.
And they just felt so much better and so much happier once they came. They just
Well, and think about even your case. I mean, you were under care with us for a while and you were holding your alignment and doing great. You got into a little fender bender, and to our surprise, you were still stable and still holding the alignment.
Yeah.
And so you didn't even have to go down that route of what most people are experiencing when they're in a car accident, because your ligaments and the muscles were already so well formed to your genetic neutral position. You were maintaining symmetry and balance.
Yeah.
Nothing was ever in a spot to be vulnerable to begin with. And you had minimal issues after the accident for something that for other people could have been that last straw that puts them into a bad space.
Yeah, I think I got an adjustment right before the accident.
Yeah,
That
which
one
is
time, which was like, yes.
Of course,
That
but
was
lucky,
really
yeah.
good. That made a
Absolutely.
huge difference. But I love to come in because I love, to get the body work too, because I get tension in my neck and shoulders.
Well, and don't get me wrong,
So I love the muscle.
the technology is amazing, but it really lays the foundation for the body to have the ability to heal. You're creating a positive environment to let it want to work properly. And so, yes, the Atlas is step 1, phase 1. We have to get the neurological body balance. We have to get the tone of the muscles that are supporting the spine balance. But the next phase, we absolutely will still scan the remainder of the body. We still will perform secondary adjustments, and emphasis on the word secondary. Atlas is always the primary. It's protecting brainstem. Secondaries might be mid-back, might be a shoulder, might be a knee, a hip. We'll still work through those. We'll still work through the manual therapy to help retrain those areas, but it heals and works through its issues so much faster than you fighting an uphill battle because you really never took care of the root cause, which is the brain and the body aren't communicating properly. That has to be number 1.
Definitely. That makes a lot of sense, because there has to be that flow of communication. Otherwise, things are going to be stuck, Yep. That
Absolutely.
is so important. So as far as helping patients, like what's your ideal patient that you really want to help that comes into the office? Is there like an ideal patient? I know you can also adjust children, right?
Absolutely.
You have a little girl, right?
Yeah,
Do you adjust her?
I have a 2.5-year-old.
Uh-huh.
Yeah, 100%. She's checked. She's not adjusted daily. That's excessive.
Right.
But she's checked, and when I see a behavior or I see something just different, or if I see her touching an area, I mean, she'll definitely get scanned and we'll keep an eye on her.
Right.
She's wild. I mean, you have
Yeah.
kids.
Yeah,
They
yeah.
jump and bounce off the couch to the trampoline to the chair and then blah, blah, blah.
Yeah.
It's tough.
That's a cute age.
But yeah, it's cool to see how that she's going to grow up in a lifestyle where that health is important, and holistic health even more so is number 1. And that is where we look first. And, she's been battling a cough for the last few days, and some of her mother's friends were just like, oh, well, you should take her to the doctor. She needs medicine. And it's like, No, we went to the store. We got some ginger. We got some garlic. We got the cucumbers, the celery, the oranges. Made her a big cocktail. She loves it.
That's
And
awesome.
yesterday was the first day where the cough was just not really there anymore. And so
That's great.
food is medicine. Like,
Absolutely.
you
My
don't need all the
daughter
other
is
stuff.
19, and she thanks me for feeding her healthy. She says, because she sees so many kids eat so unhealthy.
Well,
even
she
though-
sees what it's doing to their body
yeah,
over time.
Even though I still think she eats unhealthy a little bit, all right? Because she's, they're teenagers, right?
That's fair.
Yeah.
But at least she knows how to eat the vegetables and the fruit and, the healthy foods. She's not all processed where a lot of her
100%.
friends are. And she literally says, thank you, Mom, because she's very like, she it's important for her being young to not just look good, but she also wants to feel good.
Of course.
But
But it starts with the education, which good for you for making sure she was
Yeah.
educated in the proper ways.
yeah, so you're doing your daughter such a favor by introducing her to ginger and all those things early in life, right?
I
Most
mean-
kids would be like, bleh,
The body has the ability
Yeah.
to heal if it can communicate and it has the proper nutrients. We always say in our talks, the two most important factors for how you age and how you heal is whether or not your brain or body can communicate and the food you stuff in your face. Two most important factors. And so, if brain and body is communicating properly, that's great. But if you're slugging down McDonald's every other day, there's going to be some other systemic issues. I don't care how good the atlas is, that's going to cause a problem.
Absolutely. Let's talk about, you guys also give talks, right? You talk at Hippocrates Health Institute.
Yeah, a bunch of places.
Yeah. What are some of the things you teach people? It's about the health, about what they eat, about the body. Is there anything else that you would like to educate people on?
I mean, we've gone through many different talks and we've had a lot of different topics that we've covered there. We do a lot of the Atlas as being the foundational element. We do a talk called Brain Health Boost where we'll get a little bit more into how the Atlas affects neurodegeneration, Parkinson's, Alzheimer's, dementia, concussion syndrome, etc. We will talk about the nervous system and we really do a deep dive into some of the quantitative findings of what's actually happening when you're adjusting the Atlas. What's happening to the neurohormonal balance? What's happening to the brain harmonization and alpha, beta, delta, gamma waves? What's really going on in the brain? And so it covers all sorts of different talks, but again, everything in the holistic realm because it's all foundational. And, I'm probably going to steal your line because you would have said this at some point today, but one of the mentors, if you will, that we look up to in the space, Dr. Porter with BrainTap, he always said that chiropractors were the original biohackers.
Yep.
And you always say it, but it's so true every time I hear it that absolutely, you're working with what God gave you, what the universe gave you, to increase function and to promote healing and well-being. And it starts with what you already have. The DNA has the instruction. You cut yourself, you will heal. So the body has the instruction. It knows how to heal. We have to help facilitate that process sometimes.
Yeah, and I love that you use the word biohacking in the book. Can you explain for people that don't really understand what biohacking is, what it means?
Yeah, perfect. Biohacking is really just utilizing technology and different lifestyle factors to enhance your health. And so some people are utilizing it on a technological side. Some are using the ice baths and the red light therapy and the methylene blue. That's another big one that people are talking about right now. And so there's all these different ways. And it's funny because we say biohack, a lot of these things they're finding or pulling, if it's not technology, they're finding them from other cultures that did it 1,000 years ago or 100 years ago.
Absolutely.
And so it's new maybe to us that are just now reading it, but it's been proven in this civilization for many, many years. And so
Kind of like the Bible.
Yeah.
It's been there. We just have to just
Open it and read
just
it.
open it and listen to it, and you listen to the body. The body can heal itself, especially holistically, right?
And you know what? And I don't think that's an excuse to just jump on any fad or trend that is biohacking. With that said, look for the research. Look for if it's duplicatable between practitioners. Look for don't look for just, it enhances mitochondria. That's it. And then there's no science, there's no research, there's no data. Look for the research and look for the duplication. And once you start seeing the trend of things that are being duplicated in different states and different countries and getting the same results, all right, now we're on to something. Now let's investigate further.
Right. Don't just listen to the buzzwords, right?
You got it.
Because people love throwing around buzzwords, you know? But
Reduces
it's-
inflammation.
Yeah, but it's so much more than that.
100%.
Right?
Yeah.
Yeah, so how can people find you, connect with you? Where do they go?
Yes.
You could look into the camera and
So we are located at 41 North Federal Highway in Pompano Beach, Suite D. Our website is www.atlasclinics.com, and our phone number is 754-432-3653. So reach out to us, and yeah.
Awesome. You won't regret it. They're amazing. And so I wanted to also say, like, I'm so excited because you guys wrote a chapter in our book,
Yes.
The Grass Grows Where I Am. I wanted to find out how has the process been for you guys writing the chapter. I read your chapter. I absolutely love it. I think it's going to resonate with a lot of people. It's very easy to read. It really gives a lot of information. And I think people will learn a lot about you guys and what you do. You also happen to be an absolutely phenomenal speaker.
Appreciate it.
You know, incredible. You've spoken at my events. You're incredible. So I just want to thank you for the trust and everything, because I know your heart, your commitment is exactly where my commitment is. You know, we're so aligned with that, you know, making a difference for others on the journey. So how is
the process has been a blast. It was fun. I was a little bit nervous, I guess, the first time. Just it's a new process and, you know, fear of the unknown. But Lisa's been amazing. Your team has been amazing. It's been cool, too, because it kind of made me peel back my own onion. And it gave me almost a new perspective to talk about our technology and our path and where we've been and where we're going. And it really just brings back, you know, I even had this conversation with Dr. Sam today. You know, there's all these other cool things out there. Stem cells are great. This is great. And at the end of the day, I truly in my heart would rather have an Atlas correction and focus on my own body than trying to hack and do all these other things with outside sources. And as cool as that is, and as much benefit as they can bring, chiropractic and making sure that your Atlas is connected and your brain and body can communicate, I'd rather pay than do that 100 times over.
because you healed yourself with it.
100%. It's
You
where the
healed
value,
yourself.
that's the true
Yeah.
value that made the difference.
I love that so much. And how's it been for you? Thank you. How's it been for you, Dr. Sam? How's been the writing, being an author in this book? Like, how's it been so far? Because, you know, there's so much more ahead. I mean, we're going to do so much to just continue, you know, really showing people the amazing work you both are doing.
Yeah, it honestly was really fun. I was never a writer in school. I was a math and science girl. So I was definitely like, I don't know what you want from me, but it was super easy. I just told my story and I wrote out everything and they cleaned it up for me and kind of put our stories together in a really fun, easy way to read. And it was just a really fun process. And I was very, very thankful for you to invite us in.
I
Because it was a
so
lot of
love
fun.
that you guys are in the book. Like, that makes me so happy because, like, we're in this together.
Yeah.
You know, like, we're going to do great things together. And I feel like you're the people I'm running with. You know, everybody that's in the book. Like, I want to, like, just, like, give you guys so much because you guys are giving so much.
We're excited to be a part of it.
Yeah, and it's the win-win. I'm really about the win-win, and I can't wait to for Chris to build your funnels and all that kind of stuff, and for you to do your Audible books. I wonder if you'll like do it like you'll read your part and he'll read his part. It'll be really cute, you know.
That'll be cool.
So yeah, I think it's really, really nice. So I'm just so grateful for you guys. Any last thing you guys want to say about healing before we end? Anything else you want to say?
I just want to say thank you for the work that you do. I know you talked a big game about us, but you also do lots and lots and lots of work behind the scenes, and you have a great ability to pull people from the holistic space and connect them together, and that really only helps the community grow larger and larger. And so thank you for doing what you do.
Thank you so much. I really couldn't do it without you guys and without my team and everybody that comes together. I think the heart has to be in the right place.
Absolutely.
And I think we all have our hearts in the right place.
Yeah.
And those are those are the people I want to run with. People that want, it's for the greater good. It's not just about me. It's about the greater good for all.
Love it.
And together we are one, WON. You know, I always say that. So I'm excited to be on the journey with you guys and can't wait to show more of what you do. And this was so much fun.
Thank
Thank
you.
you so much for being here.
Thank
today.
you for
Appreciate it.
having us.
Yeah. I want to thank you again today for joining me on the World Healing Tour podcast. Until next time, remember to do these 3 important elements. Practice them every day because they really make a difference and they're completely free. Number 1, every day remember to have a grateful heart and connect to your gratitude. When you are connected to gratitude, you are connected to positive feelings and positive emotions, and therefore drawing more positive people, things, and experiences into your life. Number 2, remember every day to ground in love and compassion, not just for yourself. Start with yourself and then share that love and compassion with others. If you want more love and compassion, you got to give an abundance of love and compassion to others, because everything you put out there always winds up coming back to you. And number 3, remember that you are not alone on this journey. It's a guided journey, right? And I say, for me, it's guided by God. So whatever it is for you, universe, higher power, just know that you're guided, you're not alone, and there's always people on the journey to support you. Until next time, my friends, have a beautiful week. Namaste. Hi, this is Noah Crane. I'm excited to share this anthology book with you, The Grass Grows Where I Am. So just join us and be a part of this incredible book to help bring your message and influence into the world. We're excited to showcase what you do to make this world better. Click the link below. The World Healing Tour Movement with your host, Noah Crane. Heal yourself, heal the world.